Hi everyone, this is Ron Lewis, and today's presentation is called How to Sign Up for Medicare When You Turn 65. The reason I decided to put this short presentation together is because a lot of my clients have questions about signing up for Medicare when they turn 65, and a lot of them find the process very confusing, and I thought I would try to help them out by putting this together. If you have any questions or comments, please don't hesitate to let me know. Signing up for Medicare is actually very easy. You apply through the Social Security Administration, and some people get Part A, which is also known as hospital insurance, and Part B, medical insurance, automatically. And other people have to sign up for Part A and Part B on their own. So for the people who get Part A automatically, if you are already getting benefits from Social Security or the Railroad Retirement Board, which is also known as the RRB, you'll automatically get Part A and Part B beginning on the first day of the month that you turn 65. If you're under 65 and disabled, you'll automatically get Part A and Part B after you get disability benefits from Social Security or certain disability benefits from the RRB for 24 months. Some people have to sign up for Part A and Part B. If you're close to age 65 but not getting Social Security, Railroad Retirement Board, or disability benefits, you'll need to apply on your own. There are 3 ways to sign up. You can do so in person, online, or by phone. If you do so in person, be sure to call first and make an appointment with your local Social Security office. And this is the link if you want to go online to sign up that way. And the phone number is 1-800-772-1213. And you can just sign up directly on the phone with someone. The initial enrollment period is 7 months long. You can first sign up for Part A and or Part B during the 7-month period that begins either 3 months before the month that you turn 65, it includes the month that you turn 65, and it ends 3 months after the month that you turn 65. So this little chart here shows you that this is the month you're turning 65 in green. So you can sign up during the 3 months before that, or the 3 months after that, or actually during that same month. But it's always best to sign up during the 3 months before your 65th birthday. The initial enrollment period, when does your coverage begin? If you sign up for Part A and or Part B during the first 3 months of your initial enrollment period, in most cases your coverage starts the first day of your birthday month. If you enroll in Part A and or Part B the month that you turn 65 or during the last 3 months of your initial enrollment period, the start date for your Medicare coverage will be delayed. So when does your coverage begin? So this chart is for people who sign up either during the month that they turn 65 or during the 3 months after that. So you can see here that there's a delay. If you sign up during the month that you turn 65, you'll have to wait until 1 month after you sign up for your coverage to begin. If you sign up 1 month after you turn 65, you'll have to wait 2 months after you sign up. And if you wait 2 to 3 months after you turn 65, you'll have to wait 3 months. So there would be a delay in coverage if you wait. So again, it's always best to sign up during that first 3 months before the month that you turn 65. And there's also something called the general enrollment period, which I'll talk about in a couple minutes here in more detail. That goes from January 1st of each year through March 31st of each year. So that's for people who missed their initial enrollment period. But if you do wait and sign up during that time, your coverage isn't going to begin until the following July 1st. So again, you could end up with no coverage at all, and this is why it's really important to sign up during your initial enrollment period, during the 3 months before your 65th birthday. So here is an example. If your birthday is April 20th, you could sign up anytime during the months of January, February, and March, or any time during the month of April, or any time during the months of May, June, and July. And now this slide talks more about the general enrollment period. If you missed your 7-month initial enrollment period, you must wait to sign up during the next general enrollment period, which is January 1st through March 31st of each year. Coverage will begin on the following July 1st. If you don't sign up during the initial enrollment period, you may have to pay a higher Part A and or Part B premium for late enrollment. So it's really important to sign up during that 3-month period before your 65th birthday. You can delay signing up for Medicare Part B. You can delay signing up for the Part B and avoid paying a penalty under certain circumstances. You are still working and have coverage through your employer, or you have employer coverage through your spouse. Special enrollment period. If you or your spouse are still working, you may have a chance to sign up for Medicare during a special enrollment period. If you didn't sign up for Part B when you were first eligible because you were covered under an employer health plan, you can sign up for Part A and or Part B anytime you're still covered by the group health plan, or during the 8-month period that begins the month after the employment ends or the coverage ends, whichever happens first. Special enrollment period and COBRA. If you are on COBRA, you are not eligible for a special enrollment period when that coverage ends. You have 8 months from the time your health insurance from your employment ends to sign up for Part B without a penalty. This period will run whether or not you choose COBRA. If you do choose COBRA, don't wait until your COBRA ends to enroll in Part B, otherwise you may have to pay a penalty. Avoid paying the Part B late enrollment penalty. If you don't sign up for Part B when you're first eligible, you may have to pay a late enrollment penalty for as long as you have Part B. Your monthly premium for Part B may go up 10% for each full 12-month period that you could have had Part B but didn't sign up for it. If you're allowed to sign up for Part B during a special enrollment period, you usually don't pay a late enrollment penalty. Here's an example of the Part B late enrollment penalty. Mr. Smith's initial enrollment period ended September 30th, 2012. He waited to sign up for Part B until March of 2015 during the general enrollment period. His Part B premium penalty is 20%. Even though Mr. Smith waited a total of 30 months to sign up, this included only 2 full 12-month periods. Mr. Smith will have to pay this penalty for as long as he has Part B. So again, it's really important to sign up in a timely manner, otherwise you're going to end up paying a penalty on your Part B premiums. This is the Medicare Part A premiums. If you or your spouse paid Medicare taxes for at least 10 years while working, you probably won't pay a monthly premium for Part A coverage. This is called premium-free Part A. If you don't qualify for Part A on your work record, you may qualify for Part A through your spouse or a former or deceased spouse. When you qualify for premium-free Part A, you should enroll as soon as you're eligible, even if you are still working. Medicare Part B premiums. If you sign up for Medicare in 2016, you will pay $121.80 a month for your Medicare Part B. Most people who signed up for Medicare before 2016 are paying $104.90 a month for their Part B coverage. If your modified adjusted gross income is above a certain amount, which is currently $85,000 a year if you file individually, or $170,000 a year if you're married and file jointly, you may pay more for your Part B premium. How is the Medicare Part B premium paid? If you get Social Security, Railroad Retirement Board, or Office of Personnel Management benefits, your Part B premium will be automatically deducted from your benefit payment. If you don't get these benefit payments, you'll receive a monthly bill and you will pay Social Security directly. You can also sign up for Medicare Easy Pay. This is a free service that automatically deducts your premium payments from your savings or checking account each month. Your Medicare card. Once you're enrolled, you'll receive your red, white, and blue Medicare card in the mail. if you're automatically enrolled, your card comes about 3 months before your 65th birthday or in the 25th month of disability benefits. Now that you've signed up for Medicare, now what? Medicare Part B covers approximately 80% of your medical costs, and it does not cover outpatient prescription drugs. You will need a Medicare Supplement, also known as Medigap insurance, to pick up the other 20% that is not covered by Medicare. I can help you with that. I'm an independent agent and I work with all the major insurance carriers, and I can shop around for you, and I'll be happy to explain how those plans work. For prescription drug information, visit Medicare.gov or call 1-800-MEDICARE. They can help you sign up on the phone. And if you have any questions with that, I'll be happy to help as well. Thank you very much. I appreciate your time, and I hope that you found this presentation to be useful. If you have any questions, comments, please call me. And this is my contact information. And I'll be happy to get you any free quotes or comparison charts on the Medicare supplements, for example, or any other basic Medicare information that you need. And also, if you need a Medicare and You guidebook, those are a really good resource, and I'll be happy to send you one as a PDF file through the email if you'd like one, or you can call Medicare directly for that as well if you want a hard copy. But if my toll-free number is right here, 866-718-1600, my cell phone, my website, my email address, and I also write an insurance blog about periodically, and that's the address right here, and my YouTube channel is right here if you want to check out some of my other videos. And if you did like this presentation or this video and found it helpful, please click like and share your comments below. It's a good idea to subscribe to my YouTube channel. That way you'll have access to all my videos and updates in the future. And finally, if you know anyone who may find this information to be helpful, please feel free to forward this video on to them. Thanks again. And again, if you have any other questions or comments and I can help in any way, please don't hesitate to let me know.